Mr. George is 61 years old and had a myocardial infarction 2 years ago. He adhered to the medication schema, but still he continued to smoke and to be physically inactive due to the fear of developing another myocardial infarction. Given his continuous exposure to the risk factors, his disease progressed towards heart failure. He was compensated hemodynamically, and during the hospitalization he started performing the cardiac rehabilitation program using the vCare system in order to test it and to learn how he will interact with it at home. Before Mr. George can proceed with his regular training at home, a patient profile must be set up, so Dr. S logs into the caretaker platform. After successfully logging in, Dr. S sees a list of patients that are currently active and inactive in the vCare system. Dr. S chooses to set up a new patient profile. First, Dr. S provides some personal information on the patient, including name, date of birth and gender. Next, Dr. S chooses a clinical pathway. As Mr. George had a myocardial infarction 2 years ago, he chooses cardiovascular fitness and decides to perform a checkup every 4 weeks. In order to provide the vCare system with background information on how to configure the daily training for Mr. George, Dr. S provides some medical background information on Mr. George, including notes on the medical history. Finally, Mr. George is presented with a summary of all data entered, and Mr. George's patient profile is completely set up.